Good afternoon, everyone. My name is Tim Driscoll. I'm working with Richard Squires. Today we'll be talking about past, present, and future treatments for the disorder known as AIDS. So a brief overview of the disease. AIDS is typically a sexually transmitted disease, but can also be contracted by sharing needles or coming in contact with bodily fluids from someone infected with the virus. AIDS stands for acquired immune deficiency. This virus weakens a person's immune system by killing off cells that are essential to fighting diseases and infections. What this means is that illnesses such as the common cold will have a much greater negative effects on the human body of someone with AIDS rather than someone without. To this day, there's no cure that gets rid of the virus completely. Only treatments are available that are able to calm the symptoms, meaning that the virus can only be controlled but not cured. Alright, so a brief history of AIDS. The AIDS epidemic really started in the early 1980s. In 1981, the U.S. had reports of unusually high rates of pneumonia and cancer in young homosexual men. This made people believe that the disease was only caused in people that are homosexual. In 1982, the disease got its name, acquired immune deficiency syndrome, or AIDS. Canada reported the first case of AIDS, and it was realized that the infection can be sexually transmitted and be caused by HIV. In 1983, it was discovered that women can become infected with AIDS through heterosexual sex. In 1985, the first international conference of AIDS was held in Georgia, USA, which is really kind of when they decided that they really needed to get this under control. In 1987, the first real treatment for it was an antiretroviral drug. It was approved. What this was, it stands for Standard Antiretroviral Therapy, ART, consists of a combination of ARV drugs that maximally suppress the HIV virus and stop the progression of the HIV disease. ART also prevents the onward transmission of HIV. In 1996, Dr. Mark Wainberg developed 3TC, a drug being used to treat HIV. This was a combination drug therapy which brought about an immediate decline of 60 to 80% of AIDS-related deaths. And by 1996, there has been an estimated amount of 23 million people living with AIDS and or HIV worldwide.
So in 1997, the FDA approved Convera. It was a combination of two drugs that was taken as a single daily tablet. So instead of having two tablets, they had one that would do the same effect. And this single tablet made it easier for people living with HIV to actually take the pill and not remember, oh, did I take both of them? Or just an easy, simple pop in the mouth. Then in the early 2000s, HIV was the #4 biggest causer of death. So that was showing how detrimental this disease was. And then also, it was the #1 killer in Africa by WHO, or the World Health Organization. So it was showing that this disease was mostly affecting third world countries. And since third world countries are developing nations, they couldn't afford these new drugs that are being made in the Western countries. So then, later that year, about the 2000s, the biggest wins was when the AIDS organizations went together and was able to talk to 5 pharmaceutical companies and reduce the treatment cost, thus helping these developed nations actually reduce the number of cases that they had. Just pause out. I'll find some more shit to talk about. So in 2003, President George Walker Bush enacted the United States President's Emergency Plan for AIDS. This was the first real step in providing monetary funding for developing countries. So the United States gave $15 billion over 5 years to help combat AIDS for countries with high infection rates of the AIDS disease. So basically, this money went to any country, no matter their status, where AIDS was a highly infectious and their #1 infectious disease. Then in 2007, WHO, the World Health Organization, and United AIDS issued a new guidelines for HIV testing. So these guidelines was towards AIDS to help widen the knowledge of the disease, and it also helped greatly increase HIV treatment and prevention. So basically, it's helped set out some new guidelines to figure out exactly how we can stop the disease from spreading earlier to other people, and how we can actually plan out and give these proper medications to the people that need it the most. All right, so we're gonna go over some moderate treatments of the AIDS infection. So, though there's no cure for AIDS, there are treatments to lessen the effect of them, and these are some of the moderate non-nucleoside reversal transplant inhibitors, or NNRTIs, turn off the protein needed by HIV to make copies of itself. Nucleosides or nucleotides, reverse transcriber inhibitors, or NRTISs, are faulty versions of the building block that HIV needs to build a copy itself. So basically it makes a fake one that attaches to and then kills it. Next, we have protease inhibitors, or PIs. It's an inactive HIV protease and another protein that HIV needs to make copies of itself. Next is ENVI or fusion inhibitors. They're T-blocks. They're HIV entry into CD4 T cells, basically a building protein of the HIV virus. Last but not least is integrase inhibitors, work by disabling a protein called integrase, which HIV uses to insert itself into the CD4 T cells. Oh, and so now to some future treatments. This goes back to 2017 when most of this research was being done. So a lot of the future treatments actually a lot of them don't have actual names, they're just code name from the internal pharmaceutical companies that are working on treatments. The first one is they're working on a new integrase inhibitor called Biograse, which is just an updated version of the greaser with higher effect. So, and then next is a new nuke, as they call it, or NRTI. Its code name is GCS131. Basically, they're trying to nuke the virus as quick as possible and to lessen the effect of it. Now, they also have a non-nuke, or NNRIT, called Dodervane, which is basically just slowly eating away at the virus. Next is a new protease inhibitor, codenamed GSPI1, so it's just an updated version of the current protease inhibitor. And they're also coming up with a new class of drug, a caspid inhibitor, codenamed GCSCA1A, which is basically going at the caspid gene inside the HIV virus. And some of these new treatments lessen the effect of the disease, and they also lessen the time needed for the drug being taken. So instead of taking a regimental daily pill take, you can take it once a month. So it's going to work for third world countries a lot easier where the problem is.
Alright guys, so in conclusion, since the outbreak of AIDS in 1980, a lot of progress has been made in the knowledge, the number of treatments, and the effectiveness of the treatments. As stated earlier, these new drugs that could be possibly coming out in the future could be used to completely prevent or even cure the disease, thus making living with the disorder much more feasible and giving hope to affected people that one day that maybe that they could be eradicated of the disease forever.